Hi, everybody. Dr. Christy Hayes here with Wildwood Vision Specialists. And today I wanted to talk to you about myopia management treatment strategies that we use here in the office. In the past, when we were diagnosing patients with myopia, even as children, we could correct it with glasses or contact lenses, but we would continue to watch their vision decrease over time, their prescription to increase over time, and there was really nothing that could be done about that progression. Now, it's kind of a new area of optometry, but we are now seeing studies showing a slowing of the progression of this myopia or nearsightedness in children by using some of these treatment strategies. So the Wildwood Vision Specialists were very excited to offer this to our patients. And it's becoming the standard of care in optometry that we not just treat myopia with standard glasses and contact lenses, but to actually help slow that down and set our patients up for long-term better eye health and vision for their entire life. So there's a couple things we can do. One thing that we encourage our parents and kids to do are behavioral modifications. So there's a few things that you can do, such as taking breaks from your near work when kids are working on computers and tablets. So just kind of helping to reduce that screen time, adjusting their posture so they're not leaning in really close when they're doing their computer and tablet work, but sitting at an appropriate distance, improved lighting so they're not working in very dim lit situations with a bright screen in front of them. And honestly, the biggest factor is outdoor play. So for every hour that a child spends indoors and especially on screens, they should spend 10 minutes outdoors. So if you think about a kid being in school for close to 8 hours a day, that's about an hour and a half of playtime outdoors that they should be having to help balance that indoor and screen time use. There's also some clinical ways that we can reduce myopia in our children. So we're going to go through each of these, but just kind of in summary, there's orthokeratology, contact lenses, there are atropine drops, there are dual focus soft contact lenses, and not yet approved in the United States, but on the horizon are myopia spectacles that would actually help slow the progression of myopia. So to start off with orthokeratology, this is also known as ortho-K or CRT. These are actually hard contact lenses that the child will sleep in at night. It kind of acts like a retainer and it gently reshapes that front surface, the cornea, and flattens that cornea. And the flattening of the cornea is what corrects their nearsightedness, so that when they take their contact lenses out in the morning after they've slept in them overnight, they are corrected visually, the cornea is flattened, and then they don't need glasses or contact lenses during the day. That's a big pro. A lot of patients really like that. The contact lenses are at home and parents can help with inserting them and removing them and making sure they're staying clean. And the way that it reshapes that cornea and flattens that cornea, that is what actually helps to slow the progression of myopia. These have been pretty extensively studied over the last few decades, and they really are showing a slowing of the progression of nearsightedness, and also that they're very safe for kids to wear. Very, very low risk of infections. Actually, children have a lower risk of infection in these contact lenses than adults do. So a very safe and effective way to slow the progression of myopia. If we do have some good studies that show all of this, like I said, and me and Dr. Kim have these studies in our back pockets. If you ever have any questions, definitely let us know. We can always get you a copy of this information as well. The next thing would be a dual focus soft contact lens. So this again is going to correct the nearsightedness. It's worn like a standard soft contact lens, like any typical soft contact lens, but the optics of it is what helps to slow the progression of myopia. So a little easier to get used to as far as the comfort of the lens, it being a soft lens versus the Ortho-K being a hard lens. And you do wear these during the day though. So these are more like a standard lens, put them in the morning, take them out at night. So little more typical, and parents are usually a little more familiar with this type of contact lens. And there are some daily options. There are some monthly options that depends on the child's prescription as to which of these would be the best fit for them, which of course we would go through with you during the exam. Another nice option, and this has been really good in our practice for kids that are maybe not ready for contact lenses. Maybe they're not interested in contact lenses. Maybe they really like wearing their glasses. Or maybe they're just younger. So maybe 6, 7 year olds that are getting starting to get myopia, or even if they're really borderline at that age, you really should not be anywhere close to myopic. So we can actually start these eye drops early on. And this is a very low concentration dilating drop. So it's not actually FDA approved, it's off label to use for myopia control. However, there are a lot of studies and continue to be a lot of studies on the efficacy of this. And this also in our office, we have seen shown great decrease in progression in our kids' progression of their myopia. So these are drops that you just put in right before bed. So one drop in each eye. Then during the day, they go about their days normally, either wearing regular contact lenses or wearing their glasses, and they're just using these drops at night. Also, for some kids that maybe were doing a contact lens to help slow the progression of their myopia, but they're still progressing a little quicker than we want them to, we can actually use this as a second therapy. So have them use ortho-K lenses and atropine drops, or have them use a dual focus soft contact lens and the atropine drops to really give them a double whammy if we need to, if they are still showing progression in their myopia. Um, so myopia spectacles, these are the glasses that are specialized to slow down the progression of myopia, but they're not approved by the FDA at this point. We do have a few that are on the horizon. So again, this would be probably a good option for kids that are not interested or ready for contact lenses. The idea is very similar to the Ortho-K and the dual focus contact lenses in that they have an area of the lens that does defocus the peripheral vision, and that is going to be what slows down the myopia progression. And where these are being used in Canada and Europe, they are showing good efficacy as well. So looking forward to the day that these become an option for our patients. Like I said earlier, we are very excited at Wildwood Vision Specialists to be on the cutting edge of this new standard of care for the children in our practice, helping to keep their eyes less nearsighted, less myopic, healthier over time, giving them better visual and ocular health outcomes for the long term. So if you ever have any questions, or if you would like to schedule your kid's appointment with our office, feel free to give us a call or text us, and we look forward to seeing you all in the not distant future.